Hello, and welcome back to Cancer Buzz. Thank you for tuning in to our special series on the COVID-19 pandemic. Every week, ACCC provides resources to help you deliver quality cancer care during this unprecedented time. Today, we look at the power of music and how it can relieve COVID-related stress for patients and cancer program staff. Dean Quick is a board-certified music therapist at Levine Cancer Institute in Charlotte, North Carolina.
Music is the great communicator and the great liberator of emotion. So we can use music to validate how we're feeling. So part of what I've been doing is creating content for my teammates in the hospital as much as I've been creating content for patients. So using and encouraging them to use music as a way to just take a moment and slow down or to motivate and speed up.
Not every program has a dedicated music therapy program like yours. So how can programs incorporate it or other therapeutic practices into their care for patients?
Well, it depends, really on the need. I think every facility needs a dedicated music therapist, but if that's just not a possibility, one of the things to look into is philanthropy, getting local charities to fund a program to get a board-certified music therapist on staff. If that's not an option, then consulting with music therapists on how to use music in their programs respectively. There's lots of free resources out there in regards to, well, especially now with the pandemic, a lot of music therapists are incorporating telehealth into their practice. And from that, they are using resources online. So providing free resources online, there's great apps for using music and meditation, like Headspace and Calm are really good ones. There's another one with a lot of user-created content called Insight Timer. That one's mostly free, and that's one that I've used for my own mindfulness-based meditation. But as far as facilities go, the first step is, if they can't fund a program, to look into philanthropy to fund a program to get a board-certified music therapist in there.
Are you seeing your patients and, I guess, providers through telehealth now that you're at home?
I am. Most of the teammate engagement has been through applications like Teams and Skype for Business. And then I've been seeing patients using Zoom just because they have a feature called original audio, which means that the patient will hear the audio that I hear. So audio quality isn't suppressed or compressed with Zoom using original sound.
Dean, are there any more tips for cancer care professionals that we can do at home?
I think it's important to actually take the time to do things, especially for folks in these high stress environments where they are on the front lines of the pandemic and treating patients. I think it's important you have to dedicate the time to yourself, because otherwise, if you don't, it builds up and it's difficult to address when the dragon starts breathing fire, if you will. So if you can just kind of stay on top of things and take time for yourself every day, even if it's just for a couple of minutes. And sometimes that's using music, that's a favorite song or music that affects you a certain way. Taking time to listen to that music, even if you're doing something else in the moment, but doing something for yourself is important.
Thank you for listening. Next week, we'll explore COVID-19's impact on rural cancer programs. Until then, for the Cancer Buzz team, I'm Summer Johnson. Stay well.